Thank you, Mr. Chairman. You asked our witness to just go at it and be, don't tell us a bunch of stuff. So I'm going to try to encourage the same discussion. And it kind of reminds me already, there's a maxim in politics, a campaign does not a candidate make. That means you don't make somebody just because you have a campaign. And it sounds to me this morning a lot about technology does not make a cost-effective health plan. The details of how to drive down costs make a cost-effective health plan. So I am wondering if you can tell me why the federal basic health option, which was supposed to be implemented in 2014 in conjunction with, not in the exchange, but in conjunction with, isn't being implemented.
Thank you, Senator, and I appreciate your interest in the basic health plan. I've heard a lot of interest in the basic health plan as I've gone around the country and talked to different states and different groups. Given the scope of all of the coverage changes that states and the federal government will be implementing for January 1, and the value that we see of building on the experience that will be gained from those changes, we expect to issue proposed rules on the basic health plan for comment this year and make them final in 2014. So the basic health plan will be operational beginning in 2015 for states that are interested in pursuing that.
Well, I know even the president has kind of weighed in and said this is important, and I certainly appreciate that. But the law says that you're supposed to implement this in 2014. And so we're very concerned about the approach by the agency in trying to thwart this effort. And so my question is, can you promise this committee that the agency is not offering any deals to states to get them to take a population that they have been able to achieve a more cost-effective delivery system for and trying to shove them onto the exchange as opposed to doing the basic health plan?
I think what we are doing is working with states to identify as much flexibility as we can to assure continuity of coverage as individuals' incomes change, and to make it possible to provide premium assistance for people to purchase coverage through the exchange.
Are you artificially raising the cost to all taxpayers by trying to lure people onto the exchange as opposed to giving them this option that is mandated by federal law to be implemented in 2014?
No.
You're sure of that?
Yes.
So if this committee asks for the specific details, it could get details?
We'll be happy to work with you to get you details, yes, Senator.
And so do you believe that you have a requirement to implement this by 2014? I get you feel you're overwhelmed by the details of technology. I got that point, but do you feel, I'm trying to emphasize a very important point here. This committee and many people on this committee are very knowledgeable about state health plans that have driven down the cost to their consumers. And so it seems as if the agency is taking, I don't know how many pages out of 900 and saying that's the health plan. It's the health plan of exchange. Where's the health plan of co-ops? Where's the health plan of the basic health plan? Where's the health plan? As far as I'm concerned, I think the president signed all 900 pages. I don't think he just said it's just this one page. And what I'm very concerned about is that the agency seems to be thinking that the technology of the exchange is somehow the holy grail, and you're trying to lure states out of pursuing these co-op or basic health plan options and lure them onto the exchange because you think it's some sort of magic. And you're ignoring 20 years of experience, at least from my state's perspective, 20 years of experience of driving down 20 to 30% more cost-effective delivery plans than what these individuals were able to get in the private sector. So we don't want to throw that away. We want it to be implemented. Our read of the statute is that you're supposed to do it in 2014 and not spend your time luring people into the exchange.
Well, I don't think we're trying to lure people into the exchange. We have funded 24 co-ops, and we are working with them to be as successful as they possibly can be, and agree with you that they're an important element of this in providing additional competition in what in many states is a very concentrated market. We agree with you. we,
So you have no fear that these can stand alone and be separate?
I'm sorry.
You have no fear that a basic plan or a co-op can stand alone and not be part of the exchange?
No.
Okay. Well, we'll look forward to seeing the details of these other state proposals you've been working on. Thank you, Mr. Chairman.
Thank you.